Well, hello, everyone, and welcome to this webinar on assessing and addressing priorities and inequities in developmental monitoring and early identification, strategies from the Act Early COVID-19 response efforts. My name is Kate Taft. I'm the Associate Director for Child and Adolescent Health at the Association of Maternal and Child Health Programs, and I am excited to be here today and to have partnered on this webinar with colleagues from the Association of University Centers on Disabilities, the American Academy of Pediatrics, and the Act Early Network and the COVID-19 response teams. And through the Act Early Network, AMCHP has been fortunate over the years to have collaborated with our federal, national, state, and community partners to support state efforts to improve early identification of autism and other developmental disabilities. And through this webinar, we aim to highlight the work that the Act Early Network has done in the COVID-19 response with a focus on strategies, learnings, and resources that can address inequities that have been exacerbated by the pandemic. So if we go to the next slide, I just wanted to do some quick housekeeping before we get started. Participant lines are muted, so please use the chat box to ask questions and offer comments throughout the webinar. We also have captioning available. To enable that on your screen, you can look at the Zoom toolbar, which is typically at the bottom, and there should be an option for closed captioning, and you can show the subtitles at the bottom of your screen or open a full transcript in a side window. Alternatively, you can access the captions in a third-party viewing verification, and that link will be posted in the chat box. And also, we are recording today's webinar, so the recording, slides, and any follow-up resources and materials will be sent via email to registered participants, and then we'll also post them on our website after the webinar. So I'll now start just with some brief context, but the Centers for Disease Control and Prevention's Learn the Signs Act Early program encourages parents and providers to learn the signs of healthy development, to monitor every child's early development, to celebrate those developmental milestones, and to take action when there's a concern. As part of the Act Early initiative and network that promotes collaboration among early childhood programs and states and jurisdictions. So children with autism or other developmental delays and disabilities can be identified early and referred to appropriate services and supports. Since the onset of the COVID-19 pandemic, we've seen disruptions in care and increased delays in early identification and early intervention services. And this is especially impacted and further heightened inequities experienced by children and families of color and those from underserved communities. And so as part of the pandemic response, the Act Early Network and partners are supporting early childhood systems, the programs, providers, and families to support recovery and strengthen resilient skills, behaviors, and resources to those children, families, and communities. So on the next slide, I'll just quickly share what we hope that you'll be able to, or will be able to do today, and that's to get an understanding of the current gaps and strengths in early childhood systems to address early identification of children's developmental needs, to share some reflections on priorities in order to advance equitable and optimal children's health and development outcomes, and then that you'll be able to hear and take away some examples from the Act Early teams on how Learn the Signs Act Early resources and strategies can be used to address those priorities. And we have two wonderful panels today to help share that information with you. So we're going to jump right in because we have a packed agenda. For the first panel, on the next slide, you'll see that this is focused on assessing the current gaps, strengths, and priorities. So I'd like to welcome our panelists, and you'll get to see their faces in a second. But they're going to share what's been seen so far in the assessment of needs for children's developmental monitoring, screening, and early identification to ensure that children and families get the services they need. So we are joined by Danielle Weber, who is the Senior Program Manager at the Association of University Centers on Disabilities, Krista Guerin, Manager for Screening and Special Healthcare Needs Initiatives at the American Academy of Pediatrics, And from our Wisconsin ACT Early team, we have Gail Chodron, Assistant Scientist, Community Training and Technical Assistance Coordinator, and Training Director at the Wisconsin LEND Program at the Weissman Center at the University of Wisconsin-Madison, and Ida Winters, a family leader, community health worker, and Wisconsin LEND graduate. So we will start with our partners at the national organization level, and I'll invite them to share what they've seen in terms of the gaps and needs for developmental monitoring, developmental screening, referral to early intervention services, and receiving early intervention services that have resulted from or been exacerbated by the pandemic, as well as the strengths and what we've seen that's been working during the pandemic response. And I'll also invite them to offer any reflections they have on priorities that public health should consider to meet the current and emerging needs for children and families. So with that, Danielle, I will turn this over to you to share some of the work that you've done and what you've seen from the ACT Early Network and COVID response teams. Danielle.
Great. Thanks a lot, Kate. Hi, everyone. I'm Danielle Weber, Senior Program Manager with the Association of University Centers on Disabilities, or AUCD. We have just a short time together during which I'll share a brief overview of our support of the ACT Early response to COVID-19 through the ACT Early Ambassador Program and also our COVID-19 response teams. You'll also hear a little bit about what we've learned from our rapid needs assessment process with the response teams. So through these efforts, we provided enhanced funding and technical assistance through August 2021 to states and territories to support the early identification of infants and young children with developmental delays and disabilities in the communities most impacted by COVID-19, and also to support family resiliency. So you can go to the slide with the map on it now, and we'll take a look at the 42 states and territories that are receiving this funding. The map that you see on this slide is an interactive one that's available on AUCD's website, where you can further explore the specific work plan activities that we're supporting across the country. Next slide. And many of you on the line are familiar with the ACT Early Ambassador Program, through which state and territorial points of contact for the Learn the Signs ACT Early program are working to improve early identification and also to promote the adoption and integration of Learn the Signs ACT Early resources into systems that serve young children and their families. Let's see. Just want to make sure we're on the right slide here, and it looks like we're good. Sorry about that. Yep, okay, great. I'm just looking at my two screens now. So the ACT Early COVID-19 response teams are an ambassador-led effort that has greatly impacted the capacity of the ACT Early network during the pandemic to respond to the needs of young children and their families. The backbone of each response team is a cross-sector stakeholder group with representatives from all of the major early childhood programs. So Title V, child welfare, WIC, Head Start are just a few examples. In the first half of the project, all of the teams were engaged in conducting a rapid needs assessment to identify current barriers and opportunities related to the 4 steps of early identification. And a high-level overview of the findings from the needs assessment process is what I'll share next. All right, next slide. So CDC and AUCD conducted 2 Qualtrics surveys, 1 team lead survey to gather overall information related to the 4 steps, and then 1 survey that went out to all key partner programs and systems in each of the 43 funded states and territories to gain more specific program and system information related to the 4 steps. So on this slide, you'll see that respondents were asked which of the 4 steps of early identification they engage in, and over 85% reported engaging in referral for services, which is step 3 of early identification, followed by developmental monitoring, step 1, and then developmental and autism screening, or step 2. So in this next figure, on the next slide there, partner programs and systems are grouped by each of the 4 steps of early identification that are identified by those colored bars there on the x-axis, and total percent of reported engagement on the y-axis. You'll see that most programs and systems reported the highest level of engagement in step 3, referral for services, which is the yellow bar there in that figure. And notably, Part C reported the highest level of engagement for providing services, which is that green bar, and general early identification reported the highest engagement in developmental monitoring, and that's the purple bar that you see there. And on the next slide, as far as COVID-19's overall impact on early identification, not surprisingly, over 90% reported that COVID-19 has highly impacted early identification, and almost 50% reported that the number of children served has decreased. So on the next slide, just as a summary, to summarize, we found a high level of overall engagement in early identification across programs and systems. It's clear that the COVID-19 pandemic has impacted all 4 steps of early identification, and mainly the number of children served overall has decreased since the pandemic started. As most of you know, the majority have transitioned to virtual remote or hybrid service delivery. Then there were similar responses across all steps of early identification. For example, resources are major barriers and needs, such as staffing, funding, and time. I think we all know that. And then similarly, training for families, training for staff and providers, training for state and federal partners is critical. A higher level of systems change is needed to support programs and systems, and also to support families during COVID-19. The partner data on the number of children served is lacking across the board. The good news is there's a high level of overall awareness about the resources and materials from Learn the Signs Act Early, and the integration of those resources has been primarily focused on promotion. And on the final slide, I believe here, we just have a list of program contacts. So you'll see those key contacts there, and we really encourage you to reach out to us at any time for further information. Thank you.
Thank you so much, Danielle. That was a great overview and a lot to share, but appreciate that. And now I want to turn it over to Krista to share what they've been doing at the AAP and some of the work from the provider perspective. Krista?
Great, thank you so much, everyone, and good morning from both of you. My name is Krista Garrett. I'm the manager of Screening and Special Healthcare Needs Initiatives at the American Academy of Pediatrics. And this morning I'm going to be presenting on 2 cooperative agreements that the AAP has with the CDC, specifically promoting developmental surveillance with Learn the Signs Act Early, as well as the COVID response project, enhanced support for the delivery of essential services to young children. I'm first going to present on the enhanced support for the delivery of essential services to young children. And before I discuss the project purpose for this cooperative agreement, I just want to acknowledge our funder, the CDC, for the ability to do this important work. We're very grateful for their support and partnership. And due to the current pandemic, we know that many children are not receiving essential health services. And the term essential health services is really used to describe public health activities that communities should undertake to provide a framework for the promotion of health for all people in all communities. And specifically for, again, our project purposes, I'll be referring to developmental monitoring, or we call it surveillance, developmental screening, as well as referral. And a recent government analysis based on data from the Centers for Medicare and Medicaid Services highlighted a decline in services used by children covered by Medicaid and the Children's Health Insurance Program. And specifically, there were 44% fewer child screening services that assess physical and cognitive development in March through May of 2020 compared to 2019. And along with the reduction in health supervision visits, developmental referrals for further evaluation and evaluation for services have also decreased. And it really has made early identification of developmental delays and disabilities more difficult during the pandemic, as well as reducing the number of children who are receiving timely services. So with this project, we specifically plan to strengthen resiliency of children, families, and communities by supporting the reestablishment of health promotion in young children and the delivery and tracking of essential service components that have been impacted by COVID-19, as well as focus on the delivery and tracking of essential services, specifically, again, developmental surveillance, screening, referral, and follow-up through telehealth, hybrid, or in-person modalities that have been impacted by the pandemic. And this project will go through July 31st of this year. Next slide, please. So again, with this project, we're really looking to highlight emerging practices who are conducting and who are able to conduct developmental surveillance, screening, and referral. And we plan to develop an educational course and a repository of emerging practices through this project. And in order to highlight some of these emerging or best practices from pediatric clinicians, we solicited emerging practice applications from pediatricians and received 26 completed applications. And we just thought it would be helpful to share some of the information that we learned through that process and just highlight some of the current challenges that clinicians are and families are facing due to the pandemic. We analyzed with a group of experts the 26 applications, and 9 applicants will be further interviewed with in-depth interviews later this month to gain further practice insight. Next slide, please. So here you'll just see a brief overview of demographics. I just want to mention that our applicants were all very diverse. So just in a sampling of key indicators, you can see diversity in terms of practice type, geographic location, patient insurance status, as well as types of health supervision visits that practices have been offering due to the COVID-19 pandemic. Next slide, please. And applicants reported the following modifications were needed in order to remain accessible to their patients. Everybody said that they did make modifications. 35% introduced interpreters, 31% helped patients find areas of Wi-Fi for connectivity, 4% of practices offered Wi-Fi in their parking lot, 12% offered family training, 38% changed their social media presence or profiles, 85% had changes in their staffing roles as well as processes, and 50% modified by changing their hours that they were available for patients. And I just want to point out the resiliency in these practices and just working to ensure that they were remaining accessible to their patients during the pandemic. And I think you can see that practices really got creative and worked hard to find ways to continue to reach their patients. Next slide, please. And when asked how much COVID has impacted early identification of developmental delays or disabilities, 12% felt that had been extremely impacted, 23% reported quite a bit, 38% expressed that early identification was moderately impacted, 23% felt that it was impacted a little bit, and just 4% stated that it hadn't been impacted at all. Thank you. Applicants also reported common barriers to developmental surveillance and screening, and they input comments which were then put into themes. So comments were high for barriers like parental reluctance, safety concerns, missed appointments, as well as completion of referral documentation. In addition, there was difficulty in sending screening tools for telehealth appointments, and it's been very time consuming for clinicians as well. Applicants also reported fewer early identification referrals and uptake due to some challenges with telehealth. And there were also reported barriers for declines in referral completion and limited referral services available. Applicants noted a shortage of staffing for therapy services such as speech therapists and many wait times across other referral agencies, which also resulted in decline for patients really completing that referral process. Many other therapy services were also closed due to the pandemic. So across all of these, I think you can see that referral and referral follow-up has really been a challenge. So as we work to complete our emerging practice interviews this month, again, like I mentioned, we're planning to develop an educational PediaLink course, educational course, identifying tools and strategies, really working to overcome some of these barriers and develop other infographic and tip sheets for clinicians as well. Next slide, please. So now I'm just going to briefly transition to another cooperative agreement with the CDC promoting developmental surveillance with Learn the Signs Act Early. Next slide, please. So the goal of this cooperative agreement is to promote and improve developmental surveillance in families, communities, and pediatric practice through the integration of Learn the Signs Act Early messages and materials. And this is a 5-year cooperative agreement that began in August of 2018, and it'll end in July of 2023. So we're currently in the 3rd year of funding. And I also just want to mention that this cooperative agreement is not focused on COVID-19. However, both projects really complement and align with one another. Next slide, please. And I just want to briefly highlight some of the tools and resources shown here that we've developed through the cooperative agreement. And just due to the interest of time, I won't be describing all these resources. However, they will be disseminated in a handout following today's webinar. Next slide, please. So in July of last year, the AAP and CDC collaborated to conduct 9 key informant interviews with pediatricians to assess gaps, barriers, and successes in developmental surveillance in pediatric practice. And much of our work this year is really centering on the results of those key informant interviews. Next slide, please. So we received over 50 applications during the call for key informants. And during the review of applications, reviewers really paid special attention, again, to the diversity of practices, in addition to current practice and knowledge related to developmental surveillance and screening. We conducted telephone interviews, which lasted approximately 1 hour using an IRB approved interview guide, and key themes from those interviews included the following. Clinicians did have a general understanding of the high-level differences between surveillance and screening. However, there were a few pediatricians that generally considered surveillance and screening to be the same process or to follow the same procedures. And the most challenging part of developmental surveillance, as identified by most pediatricians, was identifying the risks, strengths, and protective factors. Many risks were discussed verbally with families and caregivers. It's challenging to probe more sensitive risks, specifically pertaining to social determinants or drivers of health. Pediatricians also noted challenges in addressing strengths and protective factors. Informants noted a lack of standardized documentation processes across providers, resulting in some challenges when reviewing previous, I don't know if everyone can still hear me. It looks like I might have lost connection.
We can hear you.
Oh, you can. Okay, sorry, just on my end. Okay, including, let's see. There were noted a lack of standardized documentation processes across providers, resulting in some challenges when reviewing previous visit notes and findings. Also, there was a lack of a standardized workflow procedure for communicating the results of surveillance, particularly challenges with communicating results across early childhood professionals and who are outside of the same EHR network. And lastly, some challenges around surveillance in immigrant and refugee communities, particularly related to challenges with continuity of care, really looking at that medical home model and the importance of it. And again, so with these key themes in mind, we're currently working with an expert group of subject matter experts to develop resources that address the gaps and barriers, specifically the development of a tip sheet for clinicians to help identify strengths, risks, and protective factors, as well as a family-friendly referral guide infographic to help families understand the next steps in the referral process. And so we're hoping to have these resources available for the dissemination by the end of the summer. And I also just want to highlight really the successes that clinicians noted when incorporating developmental surveillance into practice. They were really able to identify developmental delays and disabilities earlier, as well as by incorporating developmental surveillance, they had the enhanced relationship between clinicians and children and families. And that, I think I've lost internet connection, but I'm glad you can still hear me. So I will turn it back over to Kate. Thank you so much.
Yes, thank you so much, Krista. And you got through it despite all the technical challenges that always seem to come up, but appreciate you, both you and Danielle, for sharing some of what you've seen from the national perspective and working with your respective constituents. So to round out this panel, I'd like to ask Gail and Ida from the Wisconsin Act Early COVID-19 response team to just share some reflections on what needs assessments, what understanding gaps and challenges mean for understanding and addressing those within a community, and just some reflections on priorities for public health programs and approaching this work. So
Yes, great. Thank you. It's good to talk to everybody. I'll kick us off a little bit here, and then I'll turn it over to Ida to share her reflections. So I'm going to start us off by sort of sharing a little bit about what we did in Wisconsin and what we learned in terms of community engagement as a priority and a strategy for addressing the kinds of inequities that we're talking about this morning. So we are part of the Act Early COVID-19 project, as we have a state project on that. We completed the CDC needs assessment at the national level, which allowed us to gather information from a number of program leaders in our state. But that's a specific vantage point on what's happening in the community. People in these positions have a specific position and vantage point on what's happening. And in our state, they happen to be a collection of white middle-aged women. So that further narrows kind of our perspective on what's really happening on the ground. So part of our needs assessment, we identified the need to do a supplemental needs assessment where we were talking to community members, and we really wanted this to be qualitative, hearing from community members what challenges they were facing, what supports they had and needed, and how they wanted to address what was happening. So we really wanted co-creation of solutions with community. So we convened a work group to work on this. Ida was one of the members of the work groups. We had a collection of Black, Latinx, and white individuals working together to approach this problem. We learned early on that we really need to challenge our assumptions about what the problem is and what will help. We're not always right, and we don't always find out that we're not right. So we also talked initially with this group about the importance of relationships with the community, trust, how to establish, reestablish, maintain trust, the importance of ongoing learning with community rather than diving in to learn from and then walking away with the information and deciding ourselves what we'll do with it. An exchange of wealth. The idea of wealth was offered to us, and it was explained in ways that changed my thinking about what it means to compensate or give back to the community, and really allowing community members to define what that is, and community leadership. So I think I really walk away from, I probably already thought this, but I walk away now really thinking if we're not doing things with community leaders at all times, at every stage of planning and action, we should really question whether the extent to which what we're doing is effective for them. The first step of our supplemental needs assessment is talking to community leaders, which we're finishing up now. They have some knowledge of what is happening for families right now, what they're experiencing. We're also able to start and expand relationships with the community by coming in and connecting with community leaders respectfully and genuinely, and then get guidance from them about whether and how to connect with other community members. So that's the stage we're at now, and the next step will be connecting with a broader set of families. And again, the point is to allow families to guide us in terms of what they want, what they need, and how they would want to address these issues instead of us solving problems for others. Some of the things that we learned from our initial community leader discussions related to the who, how, and kind of what of connecting with the community. They really pointed out, people have heard this before, and many states are doing this quite well. This isn't new information, but it's important information. That it's important for the outreach to be by someone who's trusted, and to really look at how can a community member be a lead or a co-partner in that outreach, which can involve investing in their leadership too, in terms of the steps of this process and promotion of early identification. How? That we should really be opening conversations and ongoing conversations, ongoing learning relationships, that we should be physically in the community, that we should be thinking about how to be of mutual benefit and asking what wealth can we offer you. Just community members sharing their thoughts is them giving away their wealth. And that wealth might not mean that we're providing a financial compensation. It might, but it also might be that we're buying food from for the event from Black-owned business, if we're meeting with the Black community and really entering into their community. But really, the community leaders can be an aid in helping us understand what would be appreciated and valued. Barriers, we are entering these situations in which trust is already damaged or broken. I think I've really come to appreciate in the last year the extent to which we don't, especially in a university setting, recognize the ways in which we're stepping on ground in which the trust is already damaged and broken from what has been done in the past and what's happening. Anyway, my final point is I really want to emphasize the importance of the community voice and partnership, community leadership, co-creation of solutions, which we often bypass because we feel like we need to act now. In the COVID-19 exacerbation of early identification challenges and inequities, we do need to act now, but we need to act now very urgently for the long term. And I don't know where this comes from. I've heard it multiple times, but I'm sure you guys have heard it. There's that idea, if you want to go fast, you're not going to go far. And if you want to go far, go slow and go together. And that was something that the community really emphasized, some community leaders emphasized to us early in this process. So I will stop there and turn it to Ida for a feet on the ground perspective.
Hi, everybody. I'm Ida Winters. I am a community health worker, and I helped out with the Learning from Families project with Gail. So, and I'm also a parent of a child with a disability. He has autism. So what I learned or saw families, they told us that they were having trouble with following through with appointments and referrals. It's because there's housing issues. So during the pandemic, there was a hold on paying rent and things such as that, but now it's kind of confusion, a lot of confusion and up in the air about stable housing for families as they'll have to move because there's no more funding being provided. Then I'm noticing with some of the children, there's lack of social interaction due to school being virtual. But I have noticed a lot of parents of children who have ASD reporting that their child is actually thriving during virtual school. And for instance, I know mine he has less bullying and, different sensory issues that goes on in the classroom since he's at home. And also, so I also am a family navigator with Next Step Clinic, and there we have families, and we shifted the way we were doing things. We were seeing clients in clinic, but we shifted to telehealth, and we think everybody has access to technology or Wi-Fi, but everybody doesn't have it. It's not just a thing that everybody has. Instead, it tends to be a luxury. So a lot of the parents who did have Wi-Fi, their children were using it for school, so they couldn't attend visits because the bandwidth wasn't great enough for them to do it plus school. So we loaned out hotspots and laptops so parents could access this, so we can do evaluations or screenings with them face-to-face, online, or face-to-face through Zoom. But like Gail said, the best thing is that the co-partnership between the university and the family, it makes the greatest difference, because what they learn, they can put together, and we can build off of it on better ways to service the community. Thank you.
Thank you, Gail and Ida, so much. And to all of our panelists, I think it's been really helpful to talk about what we've seen, and then also just really understand that we have to ground what some of the challenges and need with the families and communities themselves to really get that holistic approach and think about moving forward to really co-create those with families and communities. And I think we'd like to move to the second panel. I did see a question in the chat about involvement of, or how AAP chapters and children's medical homes were involved in the project. Danielle, I believe that came in during yours, but we might get some, actually, I think some good examples of what that looks like from the ACT Early teams in this next panel. But Danielle, please feel free to chat in any additional context you would like. So now we'll move to our second panel, which is focused on how the state and community teams are using the Learn to Signs Act Early resources and strategies for more equitable systems that support children's development, early identification, and early intervention. I'd like to introduce and then turn this over to our moderator for the next panel, Deepa Srinivasavardhan from New Jersey's SPAN Parent Advocacy Network, and she's New Jersey's ACT Early ambassador and the lead for their ACT Early COVID-19 response team. So Deepa, thank you so much for being here, and I will turn it over to you.
Thank you, Kate. As Kate said, my name is Deepa Srinivasavardhan, and I'm really excited to be moderating this panel of fellow ambassadors that will be focused on sharing strategies and resources from the ACT Early COVID-19 recovery and response efforts that they are all engaged in. So our panelists, without any further ado, are my amazing colleagues, Toni Whitaker from Tennessee. She's the lead for the Tennessee's ACT Early COVID-19 response team and professor of pediatrics and the division chief in developmental pediatrics, LEN program director at the University of Tennessee Health Science Center. Our next panelist is Carmen Wenger, Alaska's ACT Early COVID-19 response team lead and program director for Help Me Grow Alaska. And last but not least, we have the Wisconsin team, Gail Chodron and Chris Bernico, co-leads for Wisconsin's ACT Early COVID-19 response team and associate professor in the Department of Rehabilitation Sciences and Technology at the University of Wisconsin, Milwaukee. So our speakers will share some of their work in using the CDC's Learn the Signs ACT Early resources and strategies to support recovery and strengthen resilience skills and behaviors of young children, families, and communities, particularly for those impacted by inequities. We will have time at the end for questions, but please feel free to continue to post those in the chat. First, we'll hear from Toni, who will share some strategies to address some of the needs and priorities from the provider perspective. I'll turn it over to you, Toni.
Thank you, Deepa. I appreciate that introduction. And I've had the honor to work with the AAP directly on a number of these ACT Early initiatives over the past few years. So I'll report sort of broadly and then touch a little bit on what we've done in Tennessee. Next slide, please. Families need education from our trusted sources, our pediatric clinicians. Pediatric clinicians have improved their efforts on developmental surveillance and screening over time, and we can provide that information to families. And how we support families in this is a lot like it's always been, but in these times when challenges are more, we need to pay a little bit more attention. While we often focus on identifying concerns and seeking help where needed, it's also very important for caregivers to know when things are going well and ways in which they can promote good continued progress for their children. Parent-engaged developmental surveillance, sometimes also called monitoring, goes hand in hand with developmental promotion and the nurturing that helps children thrive. Positive parenting approaches also feed into improved resiliency in the family, which is especially important when challenges are increased. When families do need to seek appropriate developmental interventions, they need direction and support from their medical home. The pediatric healthcare providers often guide families through these sometimes very complex systems. And during a year when their own practices were changing by necessity, this has been especially difficult but critical. Next slide, please. Healthcare providers need timely, evidence-based knowledge and skills to identify developmental concerns and intervene appropriately. Fortunately, quite a bit of quality information has been available from the AAP on developmental surveillance and screening, including in the recent 2020 clinical report on promoting optimal development. Now, this already existed, but multi-pronged efforts have been underway and will continue to promote and support clinicians. The AAP at a national level and state AAP chapters have been integral in providing information and education on surveillance and screening for healthcare providers, though as Ms. Garrett mentioned, there remain some gaps in understanding and in how these are delivered. We need to continue to identify opportunities for promotion and education, provision of resources, and strategies for implementation. As was mentioned, through the AAP and CDC cooperative agreements since 2014, a variety of additional resources have been developed and promoted to pediatricians and other pediatric healthcare providers. And we've listed them here. I expanded a little bit on what Ms. Garrett had on the prior slide. And again, we'll have these listed as resources in the references after the webinar. And these have ranged from general promotion to more specific training to improve surveillance and screening practices. Next slide, please. Healthcare providers also need connections with the intervention systems that directly serve families. At a very basic level, medical practices need adequate specific information for families on available services. Bidirectional information exchange for referrals helps the process go so much more smoothly for everyone, especially the families. In fact, as many of you already know, one of the steps of recommended surveillance from the AAP guidelines is to share and obtain opinions and findings with other professionals. So this matches perfectly. State AAP chapters are also quite often helpful in facilitating connections by promoting state and local access and eligibility information, just sharing that, and sometimes offer opportunities to meet or have even greater collaboration. Resources for providers can help improve their own practices, and it's important for providers to have very good quality family-centered resources to share. When clinicians discuss milestone checklists or tips or other information in such resources, they really are helping engage the caregivers in developmental promotion themselves. Parents who have received something in hand or a digital reference for later use will benefit from the reinforcement of having seen that information twice, not simply from the conversation in the office, though that is certainly a value as well. Next slide, please. Ms. Garrett also talked about some of the AAP's work to assess needs, and I'll just add a few comments for time. The process of identifying gaps and opportunities to best support families has always been important. The AAP initiatives around surveillance and screening sought to do that even before the pandemic, of course, but with now greater urgency as many of the gaps have widened. We have to have mechanisms in place as before, but also now to ensure that every child has access to early identification and intervention. During this public health crisis, as is too often the case, disadvantages are often magnified as some are disproportionately affected. Those who need help the most are often the very ones who have the most difficulty accessing and adapting in complicated and changing systems. The more the reason for our healthcare providers and systems to be attuned to those needs. In many communities, it took some time to develop new ways to deliver services to kids, whether in medical settings, early intervention programs, or schools, and we haven't perfected some of them yet. For example, telehealth, as has been mentioned, telehealth may be great for those with access, but for those who may be in poverty or living in a rural area, that may not work as well. So we have to keep attuned to those needs. Importantly, state and national promotions, such as through the AAP and CDC, have helped folks recognize the need for some of those health supervisions that were mentioned as dropping off for a bit. So it's important that we keep up the efforts not only to tell our providers, but our families about the need for getting kids in for their well care visits, where typically we do the developmental screening and surveillance in the medical home. Next slide, please. The Act to Early State Teams COVID response has provided partnerships and resources to better connect those medical professionals to early childhood systems of care. State teams have approached this very differently and appropriately to their own needs, but since state AAP chapter representatives were expected to be involved in all teams in some way. It really was a great chance to either create or strengthen and expand existing relationships. As the Tennessee ambassador, I'll mention briefly some of our work to support healthcare providers and collaborations with our early childhood systems. This is just one example of ways in which medical providers can work with state systems, and one component of the work we've done for the ACT Early COVID response. In our Tennessee AAP chapter, we, in partnership with the Tennessee Early Intervention System, or our Part C program, we provide free trainings on developmental screening, surveillance and screening statewide for primary care physicians, clinicians, health professions students, and also some early childhood professionals such as home visitors from Title V programs. Next slide. Our screening tools and referral training program trains on specific developmental and behavioral screening tools with case-based examples, as well as rationale for screening and surveillance, tips for discussion of screening results, strategies for implementing efficient workflow, and promotes resources for families, including ACT Early materials. Importantly, specific information instructions on accessing Tennessee Early Intervention System are provided, and we have direct connections with the early intervention representatives most often. This year, we've expanded those trainings for early childhood professionals and targeted additional training components to meet their needs. For our team and other state teams, it will be important to maintain ongoing collaborations among partners as we continue to support each other. And with that, I will say thanks and tag in the next person.
Thanks, Tony. Next, we'll hear from Carmen in Alaska about the work that her team has been doing with the Alaskan Native communities. I'll turn it over to you, Carmen.
Thank you, Deepa. I will start this morning with a land acknowledgement. I live and work on Dena'ina land, and the projects I'll be discussing this morning have been conducted in several communities around Alaska on traditional Ahtna, Alutiiq, Dena'ina, Inupiat, Tlingit, and Yupik land. I'm thankful to the past, current, and future caretakers of these places that allow us to be present for the work that our team is doing. Next slide, please. Alaska took on 3 implementation projects, 2 of which had a statewide focus, and 1 of which had a community level focus. All three of these deal with representation and increasing equity through both access and cultural functionality. The 2 state level projects focused on broad-based revisions to materials to visually reflect things familiar to Alaska children and families, as well as the dissemination of local contact information for early intervention programs and organizations that help connect families to services. As you can see from the pictures, draft illustrations from the revised version of Baby's Busy Day include elements of the landscape. The draft Amazing Me illustration depicts subsistence activities, and the pictures used in the Milestone Moments booklet are of Alaskan families. The primary focus for my presentation today, however, is of our third activity, which involves working at the community level to create developmental screening companion documents in 2 regions of the state. One of the projects is in collaboration with the Norton Sound Early Childhood Coalition, where we've been able to leverage a previous project adapting Learn the Signs, Act Early milestone checklists. The second project is in the Southeast region of the state and is a collaboration with the Tlingit and Haida Head Start program, where they have recently implemented the ASQ3. Next slide, please. Because our time together is short, I will only be going over a few key takeaways from our work in collaboration with the tribal and community organizations. There's a lot more we have learned about process that I would be happy to share at another time. Our first key takeaway is following established guidelines or community protocols for work. Sometimes, as with our book project, there are literal guidelines available to follow, but it's important to look for them. Only through research did we find the document pictured here, Guidelines for Respecting Cultural Knowledge, that was adopted by the Assembly for Alaska Native Educators and published by the Alaska Native Knowledge Network. There's a section on guidelines for authors and illustrators that we included in our amazing book RFP, and that we require everyone working on the project to follow. Other areas of this work are significantly less clear. For our adaptation projects, we are working with partners in tribal health organizations and in tribal council programs, We work with communities and organizations where we have established relationships or contacts and do not move forward until we either had a commitment from the local coalition or a group from an established and reputable entity willing to support the project. Hearing from and responding to the community about their priorities. This happens in both big and small ways, but at the end of the day, projects should be driven by the goals and needs of the community where the work is being done. The initial concept for this project came out of the Norton Sound Early Childhood Coalition meeting in 2018. And while that initial discussion had a slightly different vision, the result has been 2 phases of a project inspired by the community with partnership from statewide systems. Adaptation in the process along the way also needs to respond to the community. For example, the focus intervals were initially selected as the recommended 9, 18, and 24 or 30 months. However, both communities had a preference to start with older intervals, so 36 and 48 months were done first. Engaging in long-term partnership. This is related to the first 2, in that work cannot be done using the parachute project model. You can't drop in, do something, and then leave expecting meaningful change. As we heard earlier, working with compensated cultural experts is important. When seeking input from experts on a topic, whether they're parents, providers, or culture bearers, the expert whose advice you are soliciting should be compensated. Sometimes people you work with are already receiving compensation through being on the clock of the job. However, if they're not, it's your job to find funding source eligible to appropriately support their time, or as we heard from Ida and Gail, make sure that compensation is appropriate to something that they find of value. And last but certainly not least, moving at the speed of trust. Community work has its own speed and rhythm, and this is often not well aligned with grant cycles. However, being responsive to the comfort and trust of those participating in the process is the only way to move forward together. Next slide, please. Both challenges and opportunities were revealed by the process, and while some were unique to COVID, many were persistent concerns. One of the primary uses for the developmental screening companion document is an opportunity to proactively provide information to families and caregivers about what developmental screening is and what it is not. In some cases, before the families see the tool itself, to provide appropriate context, to give guidance on how to access or substitute needed supplies, and to encourage use of primary language spoken in the home, or to give examples of sounds or words in local languages. Once you've worked with a community to curate information around a topic, for our project, it was context for developmental screening. It can often be used across multiple settings. For example, a script was written for a radio PSA that will be recorded soon to be aired this summer while many community members are at fish camp to increase community knowledge of developmental screening. Next slide, please. Due to the time difference this morning, I did not have a partner join live for this presentation. However, several contributed quotes about their participation so far in the companion document project. As you can see, the project influenced participants at many levels: community members, system partners, and the emerging workforce. Each of these different levels contributed something unique to the project, and they each play a different role in its sustainability. Next slide, please. I'm happy to connect further about these projects or the work of the Alaska Act Early team. But due to time, with that, I will turn it back over to you, Diva.
Thanks, Carmen. And next we'll hear again from the Wisconsin team to share some of the strategies and the work they have been doing to build off of the reflections offered in the first panel. Chris and Gail, I'll turn it over to you.
Thank you. It's really great to be here. I must say that today is a beautiful day in Wisconsin. So it's a noisy day in the neighborhood. And I hope it's not too distracting. I'm the ACT Early Ambassador to Wisconsin, and I want to share with you some of our unique efforts that we're doing in Wisconsin as part of the ACT Early response to COVID-19 opportunity. And so we did, as Danielle commented, we worked with stakeholders across the state. And so we're working primarily with Wisconsin Family Foundation's home visiting program, the Birth to 3 program, and also our Reach Out and Read program in Wisconsin. And our media that we're using is, and one of the tools includes the Learn the Signs, Act Early books. So we're using the 1, 2, and 3-year-old books. And we're also using Bouncing Back with Big Bird book, which is a book about resiliency. Our rationale for using the books as a primary resource is because we know when parents and children engage in activities that bring mutual enjoyment and they're sharing time together, that activity in and of itself promotes resiliency. So while working with the 1, 2, and 3-year-old books, parents are learning about developmental milestones and also learning about ways to speak with or connect with physicians. We also know that the Bouncing Back with Big Bird book talks about, or is a story about, resiliency and bouncing back. Some of our other efforts include working with Milwaukee County and Waukesha County, which are highly populated counties that have a significant percentage of underserved individuals. And we partnered on a diaper drive. And so we provided the milestone moment booklets to the United Way of Wisconsin so that they could put the booklets into the packets for the families during the diaper drive. And finally, I'll just mention we are doing a bus campaign in Milwaukee where we do have the Learn the Signs, Act Early app poster in the bus shelters and also in buses throughout the city of Milwaukee. So those are our primary efforts on the Act Early response to COVID-19 grant. And I'll turn it over to Gail for some final comments.
Hi, I don't have much to add there. Chris, thank you for your fabulous examples. We were one of the first states to work on the Act Early campaign, I think, early adopters. And so we have, we're fortunate that we have a very sustained materials printing and dissemination strategy. And we have had integrations in the past that are sustained in the home visiting program statewide, and in early childhood, early Head Start, and a range of programs, and on all of our state training on the Wisconsin Early Model Learning Standards for early childcare providers into a statewide early childhood professional training that's taken by a lot of home visitors within and outside of Family Foundation's home visiting, which is the McPhee funded program, and integration into all of our statewide trainings on, or many of our statewide trainings on developmental and autism screening that reach primary care providers. So this was an opportunity for us to explore some new ways of doing outreach. And I just want to express gratitude to Ida, who is one of the folks on our team who gave us some fresh ideas on some outreach materials that we considered and are now reconsidering. We were thinking about some postcards related to promoting the app, but she encouraged us to have a discussion with families and really ask them what type of information about the app would help them to, what they engage with and be interested in. So it might be more of a takeaway item, like a chips clip or something like that. So anyway, gratitude to everyone in our state who's helping us now and has helped us with the sustained work.
Thank you, Chris and Gail. And thanks to all our panelists for sharing some excellent examples of resources and strategies from their Act Early COVID response projects. I know these are great examples that a lot of us on the call would be able to use as we approach this work. We in New Jersey have a lot of similar activities happening here, but I know there are definitely some that I would like to steal shamelessly. So feel free to use these strategies and resources in your work, and reach out to our panelists if you have any questions. I don't see any questions in the chat so far, so I'm going to just turn it over to Kate, since we're all up on time, to wrap us up.
Well, thank you, Deepa, and a big thank you to all of our speakers and our partners and the partners you work with for a really informative and great webinar. There was a lot presented. I hope that all of you on the call today had a chance to learn something new, like a new understanding or a new strategy or resource that you can take in your work. On this slide are just a few links for more information, but we'll also be sending out a resource list and some more materials post-webinar, along with the recording, a brief evaluation and slides. So again, we really appreciate everyone joining us today. We look forward to continued opportunities to connect and work together and to share information as we support recovery and strengthen resilience for children, families, and communities. Thank you all very much. Bye.